Hi everyone, I'm Dr. Stuart Frost, coming to you live from Frost Orthodontics, home of the Frost Smile. Excited to share with you today. After being in orthodontics for many years, you get to a point where you really enjoy certain procedures. You enjoy doing things that are exciting and change lives and really build confidence in patients. And one of those procedures is Gummy Smile. About a few years ago, maybe 2 or 3 years ago, I wrote a book. And if anybody's interested in this, the book is The Artistry of Orthodontics. And I believe that what we do as orthodontists is more than just straightening teeth. We're creating beautiful artistic smiles. This is on Amazon. This is not trying to make a sales ploy to sell my book. But if you are interested in learning more about what makes an artistic smile, a beautiful artistic smile, this is the book for you. And you can find it on Amazon. Today I wanted to take a moment to talk about gummy smile treatment. This is something that I feel is really exciting in our profession of orthodontics, because up until about 10 to 12 years ago, if you had a gummy smile, we would send you to the oral surgeon and they would do a surgical procedure to fix the amount of gum show that you have. And over the last 10 to 12 years, we've really worked hard on finding a solution, a non-surgical solution to fix the gummy smile. In fact, if you go to my Instagram at Dr. Stuart Frost or at Frost Smiles, or at my partner's Instagram at Dr. Trevor Nichols, is that correct? Make sure. You can see these gummy smile transformations, and basically what we're doing is we're using braces and some mini or micro screw or mini screw temporary anchor devices to help raise up the teeth. And I want to show you a case that we've done. It's one of our favorites that has changed and transformed this female's life. Many of these patients that we put a mini screw in and we raise up the gum tissue, raise the teeth up, when they take the braces off, they sob and they cry because it's such a life-changing event for them to see themselves as different. And so I'd love to show you this case right here. About 10 years ago, we started seeing this mini screw assisted change in gummy smile happening in Korea and in Asian countries, and it's made its way to America, and we were doing this and changing lives. So I'm going to show you this case. This is Jodi, and Jodi came to see us, and this is the whole reason that we're talking about gummy smile today, because she absolutely does not like her smile. In fact, she hates her smile so much that she's looking for a solution. And again, in the past, this would be a surgical solution. We'd put braces on, we'd send to the oral maxillofacial surgeon, and the surgeon would take a wedge of gum tissue out and a bone out and raise the whole upper jaw up, and then we would finish with braces. Well, today we can treat this patient completely different, and you can see this gummy smile goes from the front all the way to the back. And in fact, we're seeing a little bit more gum show on one side than the other. And what we're gonna do is use braces and some mini screws that are put into the gums, and I'll show that to you in a second. And through the process of braces, we're gonna raise up the teeth, the bone's gonna remodel, the tissues are gonna remodel, and we're gonna eliminate this gummy show. Now, if you look and you can see her teeth, she has a very nice smile. The teeth shapes look really nice. But what we want to do is raise up the teeth, bring the lowers to match, and correct her gummy smile. So I'll go through and show you just a few things. Now, this is the day that we went and put the braces on. You can see, again, she's not smiling her authentic smile, but you can see these are the day the braces go on. We're still showing that gum tissue. These are Damon brackets. These are Damon clear brackets. And you can see that, that we've used these brackets and placed them like we normally would. And then we go through treatment like we would normally do with changing wires out. This is where I want to show you our screws. Now, we have different progresses that we take photos on, but basically this is a mini screw. And we call it a temporary anchor device or mini screw. We take this and we numb the gum tissue up so that the patient doesn't feel this. We put this into the bone, it acts as an anchor, and then we use this little clear chain that will raise up to the anchor, and it allows us to move the whole upper jaw up, and we get this nice change. And you can see these are just different procedures along the way. Now, we use two, And you can see that here's one here. Unfortunately, sometimes when we do these, we may have one that comes out, we reposition it. So you can see how we'll reposition one and put it back in. And this is showing putting one back in and hooking this back up. So most of the time I see when we're doing these mini screw assisted gummy smile cases, we will use about 10 months to 12 months of intrusion to raise up the teeth. And this whole procedure is usually taking anywhere from 18 to 24 months. We started doing this, trying to refine this process, and now we're getting down to the point with 16 to 18 months of treatment where we can treat a full gummy smile like this case, and pretty exciting. So I'll just show you what happens as this case progresses. We get closer to being done. This is about 9 months of intrusion. If we were to show you where she started from, we could go back up and we could show our initial. This is showing our progress. This is what's so exciting is that after about 8 months of intrusion, you can see that this is intruding. Notice that sometimes we intrude or we bring reduce the gummy smile, we have a little bit more gum show on one side, and then we just use an asymmetric intrusion. We finish this off. So this is mid-treatment. I'll show you her finals, and you can see that when we take the braces off, this is so the day we take the braces off, we will smooth and polish the teeth, and then we do what is called a gingivectomy, and my partner Dr. Trevor Nichols is going to talk to us about how we do that.
So I'm Dr. Trevor Nichols. I'm the fortunate partner of Dr. Stuart Frost. So Dr. Frost did a great job explaining to us the history of gummy smile treatment as he's evolved in that and taught many orthodontists how to do that. One of the important parts for us after we've done our intrusion or we've lifted the teeth up and reduced the amount of gum show is to make sure that we contour and reshape the gum tissues as well as the hard tissues, which are the teeth. So with Jodi's case here, as you can see, now this is again the day the braces come off. You can see she still has the little mini screws Dr. Frost had mentioned in the upper, and you'll notice that the tissues look a little bit white. The reason the tissues look a little bit white, we call that blanched, is because we've placed some topical numbing gel over top the tissues to prepare us to use a special laser that we then can use to help us to reshape the gum tissues. Now we find that in many of these cases that the tissues and the teeth are not the appropriate size and shape. So it's our job, and part of creating a beautiful smile is making sure the gum tissues are perfect to make sure that this smile flows evenly from front to back and that you can show off those big, beautiful, bright white teeth. So looking again at Jodi's case, as we look and see, we want to reshape the gum tissues to make sure that they match, and then go through and make sure that the edges of the teeth match as well. So again, we numb the patient just using a numbing gel to make sure they're comfortable, and we use a special diode laser to accomplish this procedure. Now we have a video here that you can see that this will show the laser. Traditionally, this was performed using a scalpel, a blade. Now we prefer this laser for two reasons. Number one, it's much more comfortable for the patient. And number two, and more importantly, is it's more predictable with the healing. So we find that we can get better results over time by using this diode laser. It takes about 15 minutes is all. It's really simple for us to do in the office, and we do these every day in our office, even 2 or 3 a day. So here is the video just to show you how this is accomplished. Now we'll post this video, a link to this video, where you can see the whole entire procedure. It's about 30 minutes with the full video showing how we numb, going through and showing how we do all of the gum recontouring, and then at the very end showing how we do the hard tissue recontouring, meaning the teeth. So in this video you'll see here Jodi is, and she's ready for her gingivectomy. And we'll scroll through a little bit here. Now we don't just do this in the front, we do this all the way across the upper to make sure, because as we know, as we're creating this beautiful smile, we're also widening the smile to make sure that when she smiles, she doesn't just have a 6-tooth smile, but she has a 14-tooth smile. So here we'll fast forward a little bit to show some of the front, to show exactly what this looks like as we go through. Now you'll notice the laser here, and the laser is just going nice and slow and removing some of the extra tissue. Now, a common question that we get when performing these procedures is, are we leaving the patient at risk for gingival recession or gum recession? And the answer is no. This tissue is extra tissue. Dr. Frost and I go and evaluate with an instrument to evaluate to make sure that there's a lot of extra tissue here, and we're going to go through and remove the unhealthy tissue that was harboring bacteria. This not only helps the patient from an aesthetic perspective, but also helps them from a gingival perspective with the health of their tissues to make sure that the gums remain healthy over time. So here you can see we're removing the extra gum tissue, and we're going through here with a little brush just to clean up some of the debris. Now this takes about a week to heal after all is done, and then the smile looks really beautiful. So again, you can see here, this is a point in the procedure where the gingivectomy is just about finished, and you can see that the gums are really beautiful. It's showing off those nice, big, beautiful teeth. And then we move into the final stage, which is the hard tissue contouring of the teeth. And that part we'll also post up for you to see as well. And this is where that procedure begins. And we'll show this again from start to finish in another video. But here you're seeing that the teeth are being reshaped. And we do this again, all the teeth on the front. This is to make sure that the line angles and the teeth can show their brightness and show shine from far away in pictures, and that the original shape of the teeth is ideal, almost like natural veneers. And this is wonderful because we don't have to go through and prepare the teeth in a way that they have to be replaced over time. This is something that's natural, and we're polishing and smoothing the teeth so they look like veneers, but it's their own natural teeth, which is really, really cool. So let's show Jodi's before and afters. If you look here at this screen, we'll go through, and here again is the debond. Here it is after the gingivectomy is performed. So notice here now the teeth, see how they shine different? If we go and show before and after the gingivectomy is performed, now we notice that the tissues of the teeth match more appropriately, right? We can see that now we're showing the teeth off in their true form. And we'll notice also the edges of the teeth have been reshaped and recontoured. The shine of these teeth, this is where they look kind of like veneers, right? They're natural and they look natural, but we're preserving the natural form of the teeth and showing them off as best we can. Now, again, this will heal. This is just a few days after the gingivectomy. This is 3 days. So you can see in just 3 days from when the gingivectomy was performed to where 3 days after the gingivectomy, you can see how this is already healing really, really nice in 3 days. Then we fast forward a little bit for about a week out, and we can see how beautiful that looks. So again, we'll go to before the gingivectomy was done on the left-hand side, to after the gingivectomy and after it's healed. Notice now that the teeth have a great size and shape. The gum tissues match from front to back, and the edges of the teeth match from front to back. And now let's look at Jodi's case. Now here she is at the gingivectomy, braces are off. And this is after the gingivectomy has been performed and it's healed. And now we can see this flows really nice from front to back. The gum tissues flow from front to back. Nothing's distracting in the smile, but the gums and teeth match really, really beautifully. So now we'll go all the way to her beginning, and we're gonna show where she started and show her final result here and how beautiful that is. Again, this is slightly distracting as we notice the smile from the beginning where she shows 4 to 6 millimeters of gum tissue. And that was her complaint, right? So now we have the intrusions been done through orthodontics in about 16 to 18 months. And then we finish with the contouring of the gum and hard tissue. And that leads for a beautiful result that we're very proud of. And we love doing this. So thank you for watching our video. If you have questions or comments, please comment below. We'll add some additional links to further videos so you can watch and learn more. But thanks for being part of this journey for us.